I'm Dr. Douglas Gagnon. I am the Douglas in the Douglas Primary Care. We've been using stem cells and PRP, hormone replacement, and regenerative medicine practice for 2 years now. PRP stands for platelet-rich plasma. We take a sample of blood from you, we put it in a centrifuge, we spin it out, and it separates into 3 layers. You have the red blood cell layer, the top layer of PPP, which is just your plasma, and the middle layer is a buffy coat, which is the PRP, which is what we actually use when we give you the injection. Today I have a very close and dear friend of mine, Debbie. She's one of the top female bodybuilders in the world. She's coming in for a stem cells and PRP treatment on her shoulder. She had been scheduled for right shoulder replacement. Along with that right shoulder replacement goes a long period and a painful period of rehabilitation afterwards. And no one who has a shoulder replacement done of her caliber is going to have the functionality that she had prior to having it done. So what we're going to be doing today is a stem cell along with a PRP treatment, which we do with all patients that come into this office. They get PRP with stem cells because we've learned over the years that we get a much better clinical outcome if we include PRP at no additional cost with the stem cell treatment.
I'm excited.
Me too.
All right, let's
So,
get going.
let's do this.
Okay.
My name is Jordan. I'm the nurse practitioner here at Douglas Primary Care. And today we have Debbie with us.
Nice.
Very nice to meet you. So we're going to be taking a look at her shoulder and see what kind of treatments that we can offer her, what we can do for her to hopefully help her feel a lot better than she does now.
I hope so.
Okay.
Yeah.
So tell me a little bit about what's going on with your shoulder.
Probably 15, 16 years ago, I had shoulder reconstruction, torn ACL, AC, bicep tendon, bone spur, so I had surgery done on it. And it was it was a hard recovery, but in a couple of years of rehabbing it and working with it, I was able to get back into competing and training and having a pretty comfortable lifestyle without pain.
Right.
And then through the year of being an athlete, competing in my sport, I took a toll on it. So now we go fast forward 15 years later, and at the very, very end of my career,
That's when everything starts.
It sort of, And through the course of it, I'd seen a shoulder doctor, and he had told me that it's sort of deteriorating.
Right.
So upon retiring, I went to see him, and he did an MRI and basically said, you need a shoulder replacement, titanium joint. So I have yet to have that done. It's been 3 or 4 years, and I've sort of been putting it off and dealing with the pain, which is managing it on a scale 1 to 10, at 8 to 10.
What do you do for the pain exactly?
Oh, I just get through it.
You get.
I just
That's
get
what
through
most
it.
people do.
Yeah, I mean, you can take pills and all, aspirin and all,
Right.
ibuprofen, but I just really manage it just by working around it. And then when I train and exercise and activities I do, I just know my body so well that I just have the ability to kind of work through it or work around it and manage it the best I can.
Do you kind of see yourself overcompensating because you have weakness in that shoulder?
Absolutely, and I have quite a bit in my muscular structure, so I'm able to use the muscle as almost like an inner joint, as a cast to kind of protect that joint, even though it does not allow me for certain movements that I'm limited to, but also my back, it also compensates for it too. But then you have pain with that in your neck and your back.
Yeah, exactly. So anytime you overcompensate for any kind of joint or muscle in your body, what happens, another muscle takes over and you end up wearing that one out, so you end up with more of a problem than you started with. Whenever you have an issue with a joint, a muscle, a tendon, you want to see a professional, get a professional opinion and see what they can do for you. So I'm going to take a look at her shoulder. I'm going to do some exercises with her shoulder, figure out what she can do, what her functions are, what she's limited to, and then we'll go from there, okay? So you can hold my hand right here.
Okay.
You can put your arm down, and can you external rotate your shoulder?
That's it.
That's it. Okay. So this is as far as she goes, basically. Okay. So just straighten out your arm for me like that and try to go up.
That's it right there.
And as soon as she goes up, there's a clicking sound in her shoulder. So there's definitely joint instability. You can go down, and also when she comes down, okay? And is it painful whenever you try to do anything like that?
Oh, yeah.
Okay, so she's having pain right now. So I won't torture her anymore. We already know she has an issue with the shoulder. So we'll go.
They have to be thrown out. Your job.
What do I do? Oh, okay.
Warm them up.
Warm them up.
Yeah.
Okay.
Yeah.
So these are, both of these are stem cells. This is all stem cells, and this is what we're using.
Yeah.
Interesting. Okay, so I don't want to drop these.
Definitely.
Okay. Okay, so.
I'm gonna take out your PRP. This is your red blood cells. This is the PPP, which is the platelet-poor plasma. And the PRP, I don't know if you can see it, there's a little buffy there right in between. That's what we want.
Interesting.
Okay, that's what has all the growth factors, all the cytokines, and
Okay.
everything like that. That's what's gonna promote the healing. So all of that right there is platelet poor. We don't want any of that. And I'll stop right about here. Okay, so we'll take
0.5.
Okay. Okay, and this is the platelet-rich. I'm just gonna pull up here. Stem cells. Empty, you want to make sure you get everything out of there.
Okay. Yeah, that.
That right there is tender.
Oh, when you push on that. So where do you guys inject this into the front medial or?
We actually go inside the joint.
Yeah.
So whether I go anterior or posterior,
Yeah, it doesn't matter.
it doesn't really matter. Once it's in the joint, it's in the joint. So I usually go posterior. So.
Okay, I thought it usually hurts going into the joint though, doesn't it?
It doesn't hurt. You feel kind of like an increase in pressure. It shouldn't be painful at all. Anytime it's painful, that means you're actually injecting into like a tendon or a muscle or something. Those are usually painful.
So I have to trust you on where you're placing this.
Definitely.
Okay, Doug.
He is good.
This is buffered lidocaine, so I'm going to inject a little bit. That way you don't feel the extra injection.
Okay.
Tattoo on your face.
Are you trying to talk about that musculoskeletal?
Yeah. What is that anyway?
That's a dragonfly.
Oh, okay.
With a Libra sign.
With a what?
Well, Libra on the tail, see?
Oh,
It's
okay.
like a Libra.
All right.
Yeah, okay.
Wasn't bad.
That was bad. See, it was the distractions.
Pull my mask down. Actual injection is over before you know it. So it's just the increase in pressure that's going to be a little bit uncomfortable. But
Yeah, I don't mind the needles. It's just that joint is so tender.
Oh, I can't
Even when
imagine.
I get massages, I'm like, nope, oh, don't touch that area.
I can imagine.
So anybody, and I know by putting a needle in a joint, I've had it done on my wrist and various things through my career of training. They're not the fun.
No, it's not fun. No.
So when I think about a needle going in a joint, I'm like, oh, that's the part that. But the needle in itself isn't a problem for me. It's just that. It's not like,
Okay. So I'll give it a couple seconds so that it can dissipate inside. I don't know, the growing anxiety, right?
It's like on a roller coaster when you're going up.
I know.
You're like, oh, I can't go down now. I gotta go down.
I know it.
That's everybody, and then they say, that's it?
That's it.
That's
Yeah.
right. That's right.
Pull it down.
You have to do this now.
Yeah, just put your hair to the side.
Okay. All right, here we go.
You won't feel anything, just pressure. It's numb.
I don't know about joint. I'm always like,
Try not to move.
yeah, I don't feel the pressure. I just feel the pressure. You're right. Yeah.
Doing okay?
Doing great.
You are going to work out though,
I'm not going to do upper body. We'll let this rest for the day.
right?
But
Yeah.
maybe lower. We'll see. Yeah, it's just pressure.
Just
Yeah.
pressure?
It's just pressure, yeah.
Okay, so this might be a little bit.
Thank you.
I need you to kind of raise your arm a little bit, as much as you can, just so the fluid can kind of, work its way inside the joint. Okay. As much as you can.
Yeah, that's the furthest I can go anyway.
Okay, that's fine. Just kind of do it back and forth, back and forth. Okay.
When you come back in a few months, you'll be able to release it all the way.
That'll be amazing because I have not been able to do that for years. So,
Band-Aid?
Oh, Band-Aid.
Okay.
yeah, there's still like a pressure in there.
Yeah. So you won't have any kind of outside swelling, obviously, right now because it's inside the joint. But it's gonna get swollen within the next couple of days. You'll feel tender.
Okay.
Just one of the most important things: don't put ice in it.
Right.
On it. Don't take ibuprofen.
Okay.
Don't take any kind of NSAIDs or anything like that.
Okay.
Because that actually does the opposite of what we're trying to do.
Okay.
Okay. So you get a little tiny Band-Aid for your bravery.
Okay. Oh, I can feel that in there.
Yeah. So
Okay.
you can feel it. That means we might on the right
goodness.
section.
Yeah, I feel it hurts a little in there.
Yeah.
A little pressure. It hurts.
It's pressure, yeah.
Yeah.
So,
It's like I can feel I'm getting the nerves spasming.
yeah.
Yeah.
Yeah. That's it. Looks very nice. Okay. So
Hey, lady, thank you so much.
I want to say, how are your genetics?
I know it, yeah.
Can you run fast? Can you jump?
I know it. Yeah.
Genetics.
Thank you. You've just seen a video of Debbie getting a treatment for her shoulder with stem cells and PRP. If you think you may be a candidate for stem cell or PRP treatment, please give us a call or check us out on our website. I can personally promise you that whenever you call this office, you will never be pressured. We will never want to perform a procedure on you that wouldn't be clinically beneficial to you. Our number one priority in this office is that you, the patient, have a beneficial clinical outcome. So please subscribe to this channel, watch the progress that Debbie's going to make on the improvement with her right shoulder as we will periodically be checking in with her.